You probably think you already know what happens when a woman has an orgasm. And honestly, most of you guys learned everything you know from movies, from porn, or from that one friend in high school who definitely didn't know what he was talking about either. Real life is a whole lot more interesting than any of that, and a whole lot more nuanced than most men ever get told. I'm Dr. Lily Harper. I'm a urology and sexual health specialist, and I've been working with men and couples for over 15 years right here in the United States. In that time, I've sat across from thousands of men, good men, caring men, men who genuinely want to do right by their partners, who just never got the real information they needed. And today I'm going to change that for you. We're going to talk about what a female orgasm actually is, how to recognize it, the 6 different types your partner can experience, and miss. This is the part most guys miss completely. How to handle the real life situations that make all of this way harder than it needs to be. Because here's the thing, the men sitting in my office aren't asking textbook questions. They're asking things like, my wife hasn't wanted to be intimate in years, where do I even start? Or, I've tried everything I can think of and nothing seems to work, what am I doing wrong? Or, she just won't talk to me about it, so how am I supposed to know what she wants? If any of those sound familiar, you're in the right place. Stick with me through this entire video because the information I'm going to share doesn't just apply to the bedroom. It applies to the whole relationship. Let's start with the basics, because the foundation matters more than most people realize. Here's the truth that almost nobody tells men straight up. Women's arousal is not mechanical. It doesn't work like a light switch that you just flip on, and it definitely doesn't build the same way yours does. For most men, arousal starts in the body. You see something, you feel something, and your body responds almost immediately. It's pretty direct, pretty fast, and pretty physical. For women, it typically works the opposite way. Arousal starts in the brain. It starts with trust, with anticipation, with feeling emotionally safe. And then, after all of that, it moves through the body. That means the connection you have with her, the tone of your voice, the pacing of how you approach intimacy, the emotional safety she feels in your presence, all of that matters just as much as anything you do physically. This is not soft, feel-good advice. This is physiology. This is how the female nervous system actually operates. So if you're wondering why the same technique that worked once doesn't seem to work anymore, or why she seems checked out even when things seem fine on the surface, this is usually why. The physical part is only half the picture. Now, let's talk about what's actually happening when a woman reaches orgasm, because once you understand the mechanics, a lot of things start to make a lot more sense. A female orgasm is a physiological event. It involves rhythmic contractions of the pelvic floor muscles. We're talking anywhere from 3 to 15 contractions, typically at intervals of about 0.8 of a second. At the same time, her heart rate spikes, her breathing accelerates, and her brain gets flooded with a powerful cocktail of dopamine, oxytocin, and endorphins. It is the body's full release of built-up tension, both physical and emotional. Now here's something important. Some women experience orgasm as waves, one building on top of the other, coming in pulses. Others experience it as one single intense peak. Some women get very vocal, others stay completely quiet. Some women's bodies flush red, others show almost no visible signs at all. There is no single formula. There is no universal look or sound that tells you definitively, that's it. Every woman's body responds differently. And honestly, her response can vary even from one encounter to the next, depending on her stress levels, her hormonal cycle, how connected she feels, and a dozen other factors. This is exactly why communication matters so much. Not because you're failing, not because something is broken, but because she's a complex human being, not a puzzle with one fixed solution. Let's get into the 6 types of orgasm, because this is where a lot of people, even men who consider themselves experienced, have real gaps in their knowledge. The first and most common is the clitoral orgasm. The clitoris is, without question, the most nerve-dense structure in the human body. We're talking over 8,000 nerve endings, which is roughly double what's found in the head of the penis. And here's something most people don't realize. The clitoris is much larger than the small external part you can see. It extends internally, wrapping around the vaginal canal. Direct or indirect stimulation, through touch, oral contact, or friction, typically creates the strongest and most predictable response for most women. If your partner has difficulty reaching orgasm through intercourse alone, this is almost certainly why, and it's completely normal. Studies suggest that somewhere between 70 and 80% of women require some form of clitoral stimulation to reach orgasm consistently. That's not a flaw. That's just anatomy. The second type is the vaginal or G-spot orgasm. The G-spot, named after gynecologist Ernst Greffenberg, is located a few centimeters inside the front wall of the vagina on the upper side. It's not so much a distinct structure as it is a region that, for many women, responds to firm, consistent pressure. The sensation from G-spot stimulation is typically described as deeper and more diffuse than a clitoral orgasm, less sharp, more of a full pelvic ache or throb. It often takes longer to build, and it requires more patience and consistency than most men initially expect. Don't rush it. Don't change what you're doing every 30 seconds because you're not sure it's working. Find a rhythm and stay with it. The third type is what we call the blended orgasm. And this one, in my clinical experience, tends to be the most intense. A blended orgasm happens when both internal and external stimulation occur simultaneously. It combines the sharp, localized intensity of clitoral stimulation with the deep, full-body sensation of internal pressure. These orgasms tend to last longer, spread through the entire body, and afterward, many women describe feeling completely relaxed, almost like every muscle in their body just let go at once. For couples who are willing to invest time and communicate openly, blended orgasms are absolutely achievable, even after years of disconnect. The fourth type is the cervical orgasm. This one is less commonly discussed, but it's real and it's important, especially for couples in long-term relationships where intercourse plays a central role. The cervix, located at the very back of the vaginal canal, contains nerve endings that, when stimulated through deep penetration, can produce a very different kind of orgasm. It's often described as a profound spreading sensation rather than a sharp peak, more of a slow, deep wave. However, and this is critical, deep cervical stimulation is highly dependent on arousal level. If she's not fully aroused, deep penetration can actually be uncomfortable or even painful. This is one of the most common sources of intimacy problems in long-term relationships that people don't talk about enough. You have to build up to it. You cannot skip the earlier stages and go straight to this. The fifth type is the nipple or erogenous zone orgasm. This one surprises a lot of people, but it's well documented in research. Nipple stimulation activates the same region of the brain, the genital sensory cortex, as direct genital stimulation. For some women, particularly with consistent patient stimulation, this pathway alone can produce a full orgasm. Beyond the nipples, other erogenous zones, the inner thighs, the back of the neck, the lower abdomen, can contribute significantly to the overall arousal picture. And for some women, sustained attention to these areas is a meaningful part of the path to orgasm. This is especially relevant for couples where medical conditions, physical limitations, or hormonal changes have affected genital sensitivity. The sixth type is the full body or energetic orgasm. This is the least physiologically straightforward of the six, but it's real, and I've had patients describe it clearly enough times that it absolutely belongs on this list. A full body orgasm isn't localized to any single area. It's a state of total physiological and emotional release, a kind of head-to-toe wave that comes from a combination of deep arousal, total psychological safety, and often breath work or sustained mindfulness during intimacy. It's less a technique you can execute and more a state you help create through everything leading up to it. For couples in longer relationships who feel like they've lost that electric connection, this is what comes back when trust and presence are genuinely restored. Now, let's get into the stuff that doesn't usually make it into these kinds of videos, because based on my 15 years of working with men and couples, the most common obstacles to satisfying intimacy are not about technique. They're about situation. The first situation, and this comes up constantly, especially among men in their 40s, 50s, and 60s, is the partner who has gone quiet. She stopped initiating. She stopped responding. Maybe she's told you she's just not interested anymore. Maybe she hasn't said anything at all, and you're just feeling the distance. And you don't know where to start because every time you try to bring it up, It either goes nowhere or turns into an argument. Here's what I want you to understand about this situation. In most cases, not all, but most, when a woman withdraws from intimacy, it's not because she's no longer capable of desire. It's because desire, for women, is deeply tied to emotional safety. If there's unresolved tension, if she feels unseen or unappreciated in the day-to-day, if past attempts at intimacy were painful, unfulfilling, or made her feel like an obligation, her nervous system essentially puts up a wall, not as punishment, not out of spite. It's a protective response. The way back in is not through more initiating, it's not through frustration, and it's definitely not through giving up. The way back in is through consistent, low-pressure connection over time. What does that look like practically? It means physical affection that has no expectation attached to it. A hand on her back, sitting close on the couch, a hug that doesn't immediately turn into something else. It means conversations where you ask about her day and you actually listen, not just wait for your turn to talk. It means making her feel like a person you want to be around, not just a partner you want something from. This process can take weeks, it can take months. And I know that's not what most of you want to hear, but the men in my practice who have put in that kind of consistent effort have, in the vast majority of cases, seen real change. It doesn't have to stay frozen. The second situation that comes up all the time is the communication gap. And I want to address this head on, because I've seen the comment that a lot of men think, if she wants something, why doesn't she just tell me? Why should I have to guess? And honestly, it's a fair question. It comes from a place of genuine frustration, not selfishness. Here's the reality. Most women, especially women who grew up in generations where female sexuality wasn't openly discussed, were never taught that it was okay to talk about what they want in bed. They were taught to be accommodating. They were taught not to make their partner feel inadequate. They learned early that bringing up what isn't working often feels riskier than just staying quiet. Add to that 20 or 30 years of a relationship where vulnerability around this topic maybe didn't go well one or two times, and the silence makes a lot more sense. So what do? You create the opening. You go first, not by putting her on the spot with a direct question in the bedroom that can feel like a test she might fail. Instead, you do it outside the bedroom in a low-stakes moment with genuine curiosity and zero agenda. Something like, I've been thinking about us lately, and I really want to make sure you feel good. Is there anything you've been wanting more of that we haven't really talked about? And then, this is the critical part, you listen without getting defensive. You don't explain why you've been doing it differently. You don't justify. You just listen, and you say thank you. That's it. That one conversation, done right, can open more doors than years of guessing. Now let's talk about the part of this that most men, especially men who've been in long-term relationships for a while, tend to rush or skip entirely. Foreplay is not optional. I know you've heard that before, but I want you to really understand why it's not optional, because it's not just about her comfort, it's about physiology. When a woman is genuinely fully aroused, her vaginal tissue engorges with blood, the same process that causes an erection in men. The vaginal canal actually lengthens and expands. Natural lubrication increases. The cervix pulls back and up, making deep penetration pleasurable rather than painful. None of this happens instantly. For most women, especially women over 40, where hormonal changes are a factor, this process can take 20 minutes or more. If you skip straight to penetration before this process is complete, you are not just shortchanging her pleasure, you are potentially causing her discomfort or pain. And pain, even mild pain, even occasional pain, trains her nervous system to associate sex with discomfort. Over time, that association becomes one of the biggest barriers to desire. Foreplay means touch, real, exploratory, unhurried touch that isn't obviously leading somewhere. It means verbal connection, telling her she's attractive, that you want her, that you're not in a rush. It means paying attention to how her body responds and adjusting based on what you notice, not based on what you think should be working. The goal of foreplay is not to check a box before you get to the main event. The goal is to get her so fully aroused that her body is almost demanding the next step. Here's something else I want to address directly, because it's one of the most counterproductive patterns I see in men who genuinely want to please their partners. The performance trap. When a man becomes fixated on making her orgasm, when it becomes the goal, the benchmark, the thing he's mentally measuring his success against, He creates a kind of invisible pressure that she can feel immediately. She can feel him tense up. She can feel the shift from, I'm enjoying this with you, to I'm working on a problem. And the moment she senses that shift, she gets pulled out of her body and into her head. She starts thinking, is this taking too long? Is he frustrated? Should I just get it over with? And the moment she's thinking those thoughts, the arousal that was building starts to fade. Not because anything went wrong, but because you changed the energy. The fix for this is genuinely simple, even if it takes practice. Take orgasm off the pedestal. Decide ahead of time that connection and pleasure are the goals, not a specific outcome. The more present you are, the more she feels that you're there for her and not for the finish line, the safer she feels to let go. And when she feels safe and relaxed and unhurried, her body does the rest. Not every time, because nothing works every time, but far more consistently than when the pressure is on. One more thing that comes up constantly with the men I work with, particularly men over 50, the impact of hormonal and physical changes on intimacy for both partners. If your partner is in perimenopause or postmenopause, her body's going through significant changes that directly affect her experience of sex. Estrogen levels drop, which can cause vaginal dryness, reduced elasticity, and decreased sensitivity. Arousal may take longer. Orgasm may take longer or feel different than it used to. These are not signs that something is broken or that she's no longer interested. They are normal, predictable physiological changes, and there are solutions. Good lubricants make an enormous difference. Slowing down the pace of foreplay and penetration helps significantly. And having an honest conversation with her doctor, or coming to see someone like me together, can open up options including hormonal and non-hormonal treatments that many couples don't even know exist. The bottom line is this: the men who consistently satisfy their partners, regardless of age, regardless of how long they've been together, regardless of what challenges have come up over the years, are not the men with the most technique. They're the men with the most patience, the most curiosity, the most willingness to be present, to listen and to adjust. Real confidence in intimacy doesn't come from performing. It comes from understanding. It comes from showing up with genuine attention and zero ego about being corrected or redirected. It comes from treating your partner's pleasure as something worth learning about. Not once, not in the first few years of a relationship, but consistently for as long as you're together. I've been doing this work for over 15 years. And without question, the couples who thrive in their intimate lives are the ones who kept talking, kept being curious about each other, and refused to let physical and emotional distance become permanent. That's available to you, no matter how long it's been, no matter how far apart things have drifted. But it starts with you deciding to take it seriously and taking one small step toward her today. I'm Dr. Lily Harper. If this resonated with you, share it with someone who needs to hear it, and drop a comment below. I personally read everyone, and I want to hear what's actually going on for you. What's your biggest challenge when it comes to intimacy with your partner right now? Let's talk about it.